that we start with our proper topics. Proper topics means what? This is a proper topic. After that, the systemic or the region wise, right? Okay. So let's start with our today's topic. The topic remains the same, is the resting membrane potential. But just this is like a part 2. In the first part, we understood that how. No, I'll never be going like that chapter wise, chapter 1, 2, 3, 4. I'll be going in such a way that you should really understand the whole physiology. Right? We'll not be going chapter wise. Say, for example, when we'll be talking about cardiology, right? So in that case, we'll be combining this thing in such a way so that you understand the clinics also, you understand ECG also, you understand Doppler also. Now, in the first year, no one will be insisting that you learn Doppler, learn ultrasound. But even if you have seen those images, it will help you a lot as you will be approaching more advanced into your Mbbs. Right? Nothing will look new as you'll be going in the second year. So we'll be going much beyond the chapter-wise thing, much beyond. That's the reason that I would say that your involvement is vital. That would be extremely vital. Sometimes it happens like in past. Say, if a batch has to be stopped, it was stopped simply because of one reason, the lack of interest. If someone feels like, no, ye cheez to hum final mein pad lenge ya second mein pad lenge. It is like education is never a forcible. Right? It can be given only if the person who is taking it is loving it. So that's the reason that there is never a force or compulsion. But yes, one thing is very true, that if you follow this method at any point of time in your medical life, you'll find any difficulty. But that's the whole purpose. Otherwise, so it is like what? Go chapter-wise chapter, right? PowerPoints are there, right? Go ahead with the slides, not disgracing any teacher, but at times students, they ask the senior students. They do say that just it is going point, PowerPoint slide by slide. I'll never ever be using any of the PowerPoint, right? Whether we are discussing surgery or we are discussing human behavior. Always clear it out. Right? So last time, the nutshell was the Nernst equation. Nernst equation. In the Nernst equation, the nutshell was that at the end of the entire show, that electromotive force, the formula was minus 61, right? This was upon Z. Z was what? You know it very well. It was the charge, right? And the log of 10, the concentration inside upon concentration outside. This was the whole game. And we calculated, and I hope you now you are comfortable with this calculation. It happened like that this Nernst equation, it is strictly for, one ion. But in our body, it never happens like that. Only sodium is working, only potassium is working. It's always a joint effort, right? And every millisecond things are changing. Right? So that's the reason there came the new equation. The person called Goldman, he gave the equation. That this equation tells that let's combine all the three major components, three major ions which will be playing a absolutely critical role: sodium, potassium, and chloride. So he said that these are the most important ions for any of the membrane action. So why not to combine it? So he used the Nernst equation, right? Minus 61. But then upon Z, he said that it would be neutralized, so it was taken off. Right? Multiplied by same style, log, but then the total of AB, that is inside concentration of sodium plus inside concentration of potassium plus inside concentration of chloride upon, you must have guessed, You must have guessed it must be outside concentration of sodium plus outside concentration of potassium plus outside concentration of chloride. That was the whole thing. This is how he said that this is what is called as the Goldman's equation. Goldman's equation is like it's integrated. There might be few questions. One of the questions is, what about calcium? What about phosphate? All of them, they also play the major role. But it is said that out of all of them, if anyone is playing a very critical role into the resting membrane potential, so that is the sodium, potassium, and the chloride. They will be playing a most important ion. These are the most important. For membrane. Z, Arya, were you there last time? Because this question has arrived. That's why I'm asking. What was Z? Were you there last time? Did you attend last lecture? Z was the charge. So sodium is plus, potassium is plus, and this chloride, right? It is minus. So it was like, let's not calculate this. That's what it is saying. That it was neutralized. Right? It is neutralized. Z was the charge. So because you are combining positive and negative charges all, so it was neutralized. Neutralized means it is considered as 1. Considered as 1. Right? So that's why minus 61 upon 1 is just 61. So it was not. It's not considered. As such, also, if you calculate, it could be like that. Okay. So sodium, potassium, and chloride, they are the most important ions for the membrane action. That's why these three are taken. Second point is that if membrane, in case of membrane, if membrane permeability, now you'll find that this is absolutely true. If the membrane permeability is 0 for any two ions, so what would happen? Third would be dominant. Right? In books, it will be written like that, but what's the big deal now? You understand it so properly. So this is quite obvious that if there is a match between, if there is a contest between 3 teams and 2 teams are not playing, right? If 2 teams are not playing, the third would be always the winner. When anyone not in last lecture, don't worry, Sean. Focus on this. You won't be having any problem. Right? You won't be having any problem. I'll explain. I'll calculate. Yes, there are few people. I'll just calculate the Nernst equation quickly. So don't worry. But at least you should be having some concept. And if you have not attended just the last lecture, you will not be having any trouble. So this is true, right? We have got 3 ions. If 2 ions are not unable to pass through, the third one would be dominant. What's the big deal? Third one would be dominant. True, right? Would be dominant. Okay. Now, this is like potassium is less, potassium is more inside. True, potassium is more inside, and it is less outside. Very quickly, those who are knowing the Nernst equation well, right? I'm writing the number and you'll be giving me the answer. But I'll be calculating it again for the benefit of those who have not attended that last time. Only one will easily pass. Absolutely. Absolutely. One would easily pass because no one is there to stop him. But still, there'll be there are some other rules also. So here it is. Let's take a very quick number. 145. And outside it is 5. What would be the EMF? Use the Nernst equation. So Nernst equation, this is for potassium. So it would be minus 61 upon Z. Z is what? Z is this charge. Right? This charge. So over here, Z is 1. Into the log table of what? Concentration inside upon concentration outside. So let's put the values. Right? So it is minus 61 log of This is concentration inside. Inside is what? This is 145. 145 upon concentration outside. It is 5. So this is 5. Right? So over here, this is minus 61. And the log, well, this would be how much? Right? 145. Right? So this is 5 3, so this will be 29. Right? 29. And all we need to do is we'll just open. Yeah, that's right. Guys have already started giving the answer. Oh, and the calculator. Here it is a calculator. We just put it into the scientific mode. Right? And in this, it was say 145 divided by 5. So this is 29, and we need to take the log of it. Right? So let's take the log of it. Log of it is 1.462. Right? And we need to multiply it by 61, and that is minus. Sorry, my mistake. Sorry. Again, so this is 29. We just take the log of it and we multiply it by 61 and the minus 61. That's right. Now it is correct, and it is minus 89.2. Many of you have already given the answer. So here it is. It would be minus 89.2. So this one would be the electromotive force, the force by which the potassiums, they are trying to go outside. Right? So this will be the most of you have given correct answer, except I'm not taking the name, but my friend, if you have written 100.9 or minus 1.462 or 8.77, nope, calculate again. First thing is, it can never be plus. It can never be plus, because if I told you, if this is the denominator. If the denominator is small, so beta, this number will always be plus. So minus, when it is multiplied by plus, will always be minus. It can never be plus. So just check it. Figure out that where you went wrong. You should not, because I know all three of you, right? All three of you, because last time you were there. So this mistake should not happen. This is indicated by minus, and minus sign is nothing that the inside cell. See, inside, right? When the potassium is going out, tell me one thing. When the potassium is going out, what is happening? The cell inside is becoming more negative, or it is more positive? It is more. Bhakti, you have to answer. Others are answering. You have to answer. I'm watching whether you are there or not. No, still you are not answering. Don't worry about
more
it.
negative.
More negative, obviously, when the potassium is going. So this will be more negative. Right? That's the thing. That's why this negative number. Ulta, right? Inside will be electronegative. That's right. And ulta, when the sodium would be more, when we'll be calculating for the sodium, and the sodium is entering into. So then when the sodium is entering into the cell is becoming more positive. So this number will become positive, right? So this was the last time. This was the crux. This was the main thing. Now we come to the third important concept. And that concept is now from where you have to start your imagination. General potential of a cell. That's right. That is right. In this condition, right? The condition which we calculate. Right? So that's a thing. So back to this. So what Goldman said, that we need to consider all other ions. So that's how we'll be coming to a conclusion. So that was pretty good. And with that, the resting membrane potential was calculated in different cell types. Now, if you have got the, say, Guyton, so in Guyton, this table is given. It's a big table, right? But I'm just taking some of those ions which we'll be discussing. Right? Say, for example, neuron. Say these are very important. So neuron, skeletal muscles, smooth muscles, smooth muscles. Then cardiac muscles for the automation, right? Automotive cardiac muscles. And the RBC, importance of RBC is when we'll be learning the coagulation mechanisms. That is how that clumping occurs and the clot is formed. So there, all these things will be playing a major role. RBC and the photoreceptors, that is in our eye. Right? They are called as the photoreceptors. Photoreceptors in the retina. So over here, there are specific numbers, and these numbers, you see how they change. Neurons, resting membrane potential, that would be -60 to -70, right? For skeletal muscle, it would be -85. And today we'll be discussing all these things and that why these numbers are changing. So you'll be having a super concept. -50 to -60. Today I'll be keeping the chat on, chat also on, and even you'll be able to unmute by yourself, because I really want a very interactive talk between you and me that you have to answer. At times, if needed, I'll just pinpoint that he or she has to answer. Then, so -80 to -90. When it comes to RBC, it is very low voltage, -8 to -12, such low, right? When it comes to photoreceptor, if it is dark, right, pitch dark, then it is -40, right? When it is dark. So that means it is just -40. But when it is bright light, then that resting membrane potential drops still more, right? -70. So that means that eyes, they are more sensitive. So from -40, it will come to 0 very fast. But from -70, it will take time. So that's the reason that in dark, the receptivity is much higher. -70 when it is light. What did you say? These are the average potential. Exactly. So when we talk about neurons, so then you talk about all the sodium potassium pump which are working, potassium channels which are working, what are they doing, their final effect, right? Where this permeability, it affects on the thickness of the cell membrane. There are other factors, everything combined, calculated. These are the final numbers. Right? These are the final numbers. Do you have to remember? Yes, in capital. Yes, you have to remember, if not more, at least this much, right? At least this much. It's not so that you just remember every number, but it should not happen that for cardiac muscles, we feel like that its resting membrane potential is -40. No, that cannot happen. Like, that cannot happen. So just you should be having a rough idea about these numbers. So you'll find that neuron, say skeletal muscle and cardiac muscles, they are almost similar. Right? And smooth muscles, that level is a bit lower. Neurons, it is general in between. Right? Regarding the RBC and photoreceptors, don't stress much at this point of time. Just you should know. Even if you don't remember it, no worries. Okay? All right. So we discussed 2 points. One, these are the important ions, and second, the membrane permeability of any 2 ions. If it is less, so obviously the third one will be the boss, because there is no one to oppose him or her. And as the potassium goes out, so cell will become more electronegative. That is also true. We can just say this is our third point. Why cardiac and skeletal muscles are almost same? It is just a coincidence, right? It is like every tissue is different, and there is no reason for it. Right? Harsh, answer this question. 5 plus 5 is equal to 10, and 3 plus 7 is equal to 10. Why? Why?
Sir, both are same.
So that's both are same. That's not the answer. But why? 5 plus 5 is becoming 10, and 3 plus 7 is also becoming 10. It's a process. They both are different process. The only thing is, result is coming same.
Yes, sir.
Right? So there can be multiple combinations. There can be multiple tissues who might be having the same resting membrane potential. But that is just the final number. It is just the final number, right? The process will be totally different. When we'll be discussing, you'll find that, wow, that the skeletal muscle and cardiac muscles, I mean, Jameen Asman ka. Because you can imagine skeletal muscle is what it is under your control, right? You can say, okay, flexing your biceps. You can't tell that right ventricular beta, jara contract hona, right? You can't. You can't tell your heart when to contract in the physiological term, right? In other terms, so it beats at a different thing. That's a totally, it's a romantic. So many answers. Light and dark, abhi mat tension yaar, तो receptor आने दो. The only difference is that, say this is, just draw karo na side, yahan pe. Say this is a timeline, right? Minus, this is 0. So minus 40 would come here and minus 70 would come here, right? And yahan pe it's a plus. So obviously from here to here, you'll be reaching to 0 faster. And from here to here, it will take more time. So this is more sensitive, right? Jara light gira, instantly you'll be able to see the things in dark, right? In the dark, you'll be able to perceive the things much more effectively. Rods, cones, pata hai na? Rods and cones. Skeletal muscle gets fatigue and voluntary muscles and cardiac never gets fatigue. That's superb. That's the beauty. One, kisne bola? Null. Must there. Very nice. This is the thing. This is the thing. So there has to be a mechanism, na? है ना? क्या must mechanism हो गया कि cardiac muscle ठक 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 ठक, and that is also not at a slow speed. It is beating even when everything is fine. Sorry. No problem. Even if it is beating at a normal pace when we are asleep, right? Even at the speed of 60 beats per minute, that means kya per second, thak 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 per second, है ना? And when we are running, when we are, right? So at that point, its rate will keep on increasing, and still till the last breath, right? It keeps on working. Skeletal muscles, मतलब जिम में 20 राउंड 20 रैप्स कर लिए तो उसके बाद तो बस है ना. So that's the thing. Very nice point what you said is, and there is amazing explanation for that. The entire mechanism is different. Why cardiac muscles they never get fatigue. कभी नहीं था. Okay. Yeah. So we talked about even this. We calculated this one Nernst equation also, and just for the reference, this was the Goldman equation in which sabka total, right? Concentration of inside total upon concentration of outside total, take a log, multiply by minus 61, and then you get the answer. Right? No one will tell you to calculate all these things, but it is important for your understanding. Nernst equation calculation can come. Okay. The fourth point of our today's discussion is that now this is like the game changer. The permeability. Permeability means cell membrane के आर पार कौन जा सकता है? Who can really go? Right? You'll find that sodium and potassium, their permeability changes very rapidly, right? It changes rapidly. Kyun? Very simple. If the channel is there, and as we said, there was a logarithmic curve. Remember that logarithmic curve? Those who were not attended last time, I'll explain it briefly. Here it is, the cell. Inside there is potassium, right? Sansar bada potassium, bahar just thoda sa. And now there is a channel. This channel is not stopping potassium. It is only for potassium. So potassium ne bhagna shuru kiya, bahar. What is happening? As they are going outside, bahar potassiums, they are rising. Right? So now, as they will rise, so these are the positive ions. They will start इनको धक्का मारना शुरू करेंगे जा वापस, right? As the positive ions over here, they will increase. So it will be generating the resistance against those who are coming out. So that's the reason that initially the speed at which the potassium ions they were coming out, that rate gradually slows down as more and more number are over here. So they will, and over here it is decreasing. So lesser and lesser potassium will come out, and gradually it will tend towards zero. Right? At that point, what happens? The outside potassium and the inside potassium, they both are same. So now it is the balance. Still, the process is going on, but jitne bahar ja rahe hain, utne andar aa rahe hain. Right? So that process, it is same. So that is the point when the transfer is almost nil, resultantly. Otherwise, there are the millions and millions of potassiums they are going, and millions are coming in. Right? It is that process in the entire body, in every cell, this function is going on. And on top of it, there is potassium pump. That pump is working. That pump is also working. So what we are getting it, that the potassium channel is effortless. Right? It is not asking for any energy. It is just a leaky channel. Leaky channel means chance mila, potassium bhaga. Sodium potassium ATPase pump is an active pump. Actively, it is transferring it. Right? And why it is actively transferring? Because यहाँ पे sodium से inside there is less sodium, but तो भी इसने पकड़ के सोडियम्स को बाहर निकाला against this much resistance. And over here, this potassium, right, which is over here, पकड़ के उसको अंदर डाला. Right? So that's how it is managing, it is balancing everything, because it has to work under pressure. Right? So it is the joint effort of sodium potassium pump and the potassium channel when the cell is at a stable level. Chloride. The permeability of chloride, it doesn't change that rapidly. Right? So it does not change. At this point of time, we are telling it does not change. Right? It changes very minor. We understand two important words. When we'll be going from minus, that is, we are talking about inside of the cell, right? Remember, everything is happening with respect to inside of the cell. We are sitting inside the cell. So from inside, we are now, our current is right now, potential is negative. And when we start becoming positive, so the word which will be used is the depolarization. Depolarization. Last batch. Right? So we use the word that they start becoming dada, right? When they start becoming powerful. Right? And then when from plus it goes towards minus, so this रोने लगते हैं. In fact, we wrote it in Hindi only. रोने लगते. It is R. R is repolarization. So whenever, when I was learning for the first time, I was under the impression depolarization means it is going down and repolarization is happy. No, then realize it is the other way around. So remember this. Because from next session onwards, this depolarization will be coming again and again. The entire game for next 2 weeks is between these two only. Right? Same, you also? You are like me. So over here, right, that is repolarization. Repolarization is reset. You can also remember it like that. Repolarization is reset. It is going back to from where it started. All right. So this was one more term. Next is, now see this, this is blood, correct? So I would say this is plasma, right? Blood vessel. So this is plasma. Then let's draw a few cells, right? So these are the cells. So in the cell, so we'll call it intracellular fluid or the intracellular environment, right? Something which what is in the cell. Okay. Inside. And the space between, this space is an in-between space. Right? This space is not the blood, right? Blood to yahan pe hai. This one is the blood. Right? So this in between space, it is called as the interstitial space. Interstitial space, right? This is plasma. I mean, in other words, this is the blood. Then there would be capillaries and very thin capillaries, and this is just a one layer system and very thin, and that's how things will be oozing into this, getting to the sub देखेंगे. But conceptually, there should not be any confusion. We are where we are. So when we talk about extracellular fluid, anything which is not intracellular is extracellular. Bas, itna simple. So when we say plasma is what? Plasma is fluid, right? So plasma plus our interstitial space. So what we say, this is ECF. And ICF, they are all inside the cells. I think that ICF is comprising about 40% of the whole thing. Cells ही इतने सारे हैं. So if when you combine all the cells, this is what really happens. So in other words, when we are talking about sodium, so then this sodium is more in ECF. When we talk about potassium, the potassium is more, right? It is more in ICF with respect to opposite side. Okay? So when we remember that sodium is more in extracellular fluid, so obviously it is less in intracellular. Barabar? Easy. So this is what is the difference between lymph and interstitial? Bacha, lymph is like, again, lymph is what it is for the immunity, right? So the way we have got the plasma, the same way it is the lymph, correct? It oozes. So there are lymphatic channels. So you, at this point of time, just consider the way we have got the capillaries, same way we have got the lymphatic channels, right? Then all the lymphatic channels, they combine, and then there is the formation of lymphatic duct, and that lymphatic duct which lands into the vena cava, right? So that's how the whole system goes. But basically, interstitial fluid, that is between the cells, lymph is for it is like the lymphatic channels which are for circulation of lymph. So lymph is a fluid. The way we say that in blood vessels or the capillaries, we have got the blood in which there is plasma. Same way, there are lymphatic channels which are conducting lymph, and the function of lymph is the immunity. It takes care of it. Its function is the detoxification. Right? Wherever any trouble is there, whenever there is infection, wherever any fight is to be, what I said, if you remember, we said that immunity system is like a commando operation. The same thing is there, that these are the lymphatic channels, these are the communication systems, which should say that send the backup forces, and then the new lymphocytes, the entire troop will start traveling towards. They should reach, and that's how the whole system will keep on working. Okay. So this was another point. One more point. So this was our fourth point. This was not the point, just the concept. The point is this. How person would really feel. It is okay telling that okay, potassium has increased and potassium has decreased. What would be the clinical symptoms? How the person would really feel? So whenever there is increase in potassium, so we'll be calling it hyper, right? Kalemia. Right? Sweat, water loss. You tell me. Ashish, क्या question पूछे? Were you there into the lecture of that osmolarity? Right? We discussed this thing in so much of detail. So much of detail that what will happen to the water when it will be going from, when there is change in the osmolarity. If not, right now we can't take this question. Because water loss is always from ECF. Water loss, right? Whenever whenever there is any water loss, it is always from CF. What is after hyper? What's the third one? Okay. No, I'm not getting your question.
So,
Huh?
so that second point, can you just explain it once again?
Which point?
Membrane permeability.
Permeability. Permeability means the ability to pass through the membrane, right? So that membrane, the ability to pass through the membrane, if it is 0 for 2 ions, right? So if 2 ions, they are not passing through the membrane, then only 1 ion is left out. Only he will be passing through the membrane and making all the changes. What obvious, na? If there are 3 players, 2 are not playing, so only the third player who is the main one. So, because if you let the patient speak, तो he'll start right from the morning. डॉक्टर साहब सवेरे 5:30 बजे उठा और पेट में ठीक नहीं था, but then wife said कि आप बाहर जा रहे हो तो एक काम करो, ये 2 पराठा खा लो. फिर नहीं खाना था, फिर भी मैंने पराठा खाया. फिर चाय तो पीनी पड़े ना, और पराठे के ऊपर ये था, घी था वगैरह. And then that's how they will be giving the history. So that is where you have to really guide them towards that. अच्छा कल रात को क्या खाया था? Immediately, right? These answers would start changing. Right? It's a very interesting. But just to remember that sign is what doctor elicits, what you elicit, and this is what is told by the patient. But some of the things, some of the symptoms, they are pretty common. Say, for example, muscle weakness. You will find muscle weakness. This is what patient would say, but patient would never say that there is flaccidity. Flaccid is what? Right now, all of you just keep your hand relaxed and just try to press the biceps. You'll find that there is some tone in the bicep, right? It is not like absolutely dhila dhala, right? There is a tone. So if you squeeze your muscle, you'll find, yes, that is what is called as the tone. That is good. That even if the muscle is not contracted, still there is some contraction, right? It is keeping that tension. Now, if you have got dada dadi at your home, try to do that. Try to squeeze their biceps. You'll find so soft, right? They are so soft, because as the age increases, as the exercise increases, as the entire body's function that starts decreasing, their tone decreases, and such muscle is called as the, remember the word, flaccid. Flaccid. They become flaccid, soft. So this is about how the muscle. Similarly, when patient feels, patient would say that feel like as if heart dhadak. What's that? It is called as palpitation, because normally right now also your heart is beating. You know? It is beating, but we don't even know it. But suddenly, if there is some major result, or if some special person is in front of you, then you feel like, yes, you actually feel like that, yes, that heart is beating. And there is a wonderful reason that why we always, jokes apart, in anatomy section, so when we were discussing liver, I raised this question. दोस्त ऐसा क्यों कहते हैं कि यार चल, you are so beautiful, I give my heart, you are my heart. क्यों ऐसा नहीं कहते कि यार, when you love someone so much, right? तो कहते हैं कि यार you are my liver, right? Heart तो इतना सा है, actually speaking, the size of the heart is equal to your fist, right? इतने मुट्ठी जितना है. You know the liver size? हाँ, this much big. Liver देना चाहिए ना, right? Instead of, so I love you heartily, इसकी बजाय how good will it look like when you say I love you hepatically, you know, hepatically. So just the thought. Okay, फिर बहुत अच्छे आंसर आए. Does heartbeat stop when we sneeze? हाँ, वो bless you इसलिए तो बोलते हैं. It doesn't stop. We say ना that you are my जिगर का टुकड़ा. अच्छा, जिगर का टुकड़ा, हाँ, तो फिर पूरा जिगर क्यों नहीं? टुकड़े टुकड़े देने से. हाँ, as such you can, yeah, because see in liver, right, there is right lobe, there is left lobe, there is caudate lobe, and there is quadrate lobe. So depending upon that you can distribute. अच्छा प्रोग्रेस कर रहे. इनफैक्ट वन ऑफ माय स्टूडेंट्स एक साथ, तो फिर किसी को ये नहीं बोल सकते कि आई लव यू रीनली. मैं कहा बोल सकते हैं, बिकॉज नाउ द किडनीज आर टू, तो एक एक को, किडनी एक को, किडनी दूसरे को, पॉसिबल. सो देन तो people started going at a cellular level. इनका बस अब फिर ब्रेक मारनी पड़ी. हाँ, हार्ट के लिए there is a reason, there is a solar plexus. Then when we'll be talking about the plexuses, new nerve plexuses. So these nerve plexuses, आपने देखा होगा, मतलब those who are ड्राइविंग करते हैं, राइट, ड्राइव कर रहे हैं आराम से मजे से, सडनली कुत्ता सामने आ गया या गाय सामने आ गई, एंड देन यू ब्रेक मारा इतना जोर से, राइट, एंड देन यू से बच गए, राइट. व्हाई इट नेवर हैपेंस लाइक आहा बच गए, शोल्डर नहीं पकड़ा, बिल्कुल यही नियर द हार्ट, बच गए, because it is the solar plexus. That's where the nerves, right, the plexus means group, right, and these are the at that particular region, all the nerves, they are making a group, and that is where there is amplification of the signals, and that is conducted to the brain. Whatever is happening, it is not happening into the body. It is just that particular section has sent the signal, and it is the brain who is perceiving, right? It is the brain who is perceiving. ये तो 3 साल पहले हमने ये बात की थी, और 10 लेवर ने पे, पता नहीं उसके बाद हाँ कितना लोगों ने रील बनाई. I know that. Anyway, so this feeling is called as the palpitations. Now palpitation, when they are physiological, that is all good, but then there are few conditions in which the palpitation will start. So that is the reason behind all these things. It is pretty same. Now we come to one graph. This one. Let's say this is minus 80 millivolt. So this minus 80 millivolt, this one, let's draw a line, and then over here, let's say this is minus 60 volt. Okay. So here this is about minus 70. Palpitation, palpitation is nothing but when you start feeling your beating heart. Feeling the beating heart. This is important. So this is minus 60 volt, minus 80 volt, minus 40 millivolt, and then all the way up. Okay. We pick up only the potassium. Right now, we pick up only the potassium. So let's consider this is resting membrane potential, RMP. And I'm drawing a line over here. So this is the resting membrane potential, and our game starts from here. So consider that we are over here. And then what is happening is, here is the cell. This one is the potassium, right? There is less potassium outside. This potassium starts traveling, right? It is going out. So this will start rising. It will start rising. What has happened to sodium channels? Sodium channels are also there, right? They are, but these sodium channels, they are blocked. They are blocked. Why should they be blocked? Why the sodium channels blocked? Because sodium channels, they say that we don't let the sodium go like this. Potassium is like open channel. जिसको आना है आए, जिसको जाना है जाए, right? Potassium can come and go, right? No restrictions. Potassium channel say no, we don't operate that. We operate at a high speed, but we operate only when it is needed. Right? So that is what is called as the voltage gated sodium channels. That means when the correct voltage would come, we'll open our floodgates, right? And then the sodium would start traveling. Till that point, right? It won't work. So sodium channels, they say we'll be operating at minus 60 millivolts. Jab tak ye voltage na hai, will not be doing anything. Now what we are measuring is, we are measuring the inside current, right? We are inside, under, right? As this potassium is going out, we are becoming slowly more positive, right? Because it is the potassium which is working. As the minus 60 millivolts, suddenly kaun jaga? This is our that sodium one. Right? Sodium said, yeah, minus 60 millivolt open, right? And the gate which was closed, now it is open, right? It means say, okay, jao, right? And the sodiums, they will start traveling. Now, in which direction sodium should travel? Now, this channel is open. Because this channel, it opened at minus 60 millivolts. So over here, the channel, over here, the sodium opens, sodium channel. Sodium opens means sodium channel opens, right? Sodium is where? More outside or inside? Outside. Outside sodium is more, right? So this sodium will be fired, right? It will not be this in this direction. It will start going inside, right? A rapid, large amount of sodium will go inside. So that means it will start becoming positive, and the positivity will be like this. Makes sense, right? Because these are the fast sodium channels. Fast sodium channels. Rapidly they will be taking it plus. And this is what is called as, we are going from minus to plus. So what phase, what name should we give to this phase? Bolo bacha. What name? Yaar, isko naam kya de? It's going from minus to plus. It is going from minus to plus. So we call this thing as depolarization. Fatafat jawab de. Start depolarization. So this means as the depolarization occurs, right, it will start going up. But there is a limit. It cannot go all the way up. At one point, what would happen? So much of sodium is going inside, right? The sodium is accumulating inside. So bahar bhi hai, but jo andar accumulate ho raha hai sodium, that will then start telling, bas, no more. So that is where that graph will come, right? It means that initially they'll they'll be going very fast, and then the speed will start getting decreased, right? And at one point, it would be like plateau. It will be like plateau. Then the repolarization baad mein, right? Then the plateau would come. Plateau is what? Plateau is that level कि now जितने sodium बाहर जा रहे हैं उतने sodium अंदर आ रहे हैं. So now the level has reached, and then the return journey would start. That's right, repolarization, and all the way it would come down, right? It would come down. Regarding repolarization, right, so many even other events would occur. But yes, you are right that after depolarization will occur. Okay? So far, so good. Now we have to visualize. What if the patient is having dhyan se suno, right? Don't even feel like that you are just entered into medical college. बिंदास, you are a doctor, right? Knowledge ना किसी के बाप का नहीं. So think like that. Your patient is having hypokalemia. Got it? Your patient is having hypokalemia. Hypokalemia means there is less potassium inside. Less potassium inside. So over here, from where? So over here, so it has got the less potassium. So from this point onwards, from minus 80 millivolt. So if, or let's take it this way. Let me change this resting membrane potential, right? Because there are several ways to change it. So let's say if the right now, for some reason, in the potential which was at minus 70, in that cell, the negativity has increased. The negativity has increased. So from minus 80 millivolt, now this is the voltage inside. So what would happen? It will take more time to reach to this level. But obvious, right? More time it will take, right? It will be taking more time, more effort. More effort would be reaching, because sodium to you'll say कि जब तक minus 60 volt नहीं आता ना, don't even talk to me. I'll not function. So it is this the function of this potassium. बेचारा potassium working किया, बस एक बार minus 60 आ गए, then the sodium would take over. But till that point, sodium won't be working. Right? Sodium channels won't open. So it will be, if the resting potential is decreased, so that means it will be requiring more efforts, and it will be requiring more time to reach to the trigger potential. Right? So this is the trigger potential. It will take more time, and then the sodium would act. Right? So when this is taking more time, this cycle is happening in every time. Right? So if the heart is beating, so now this is the situation 1. This is in situation if the heart is beating like that, right? In situation 2, heart would be beating like, because in starting time it is taking more time. Over here it is taking more time, right? It is taking more time. So that is what we have to understand, that when the things drop, right, when the resting membrane potentially goes down, so the entire cycle gets delayed, because the potassium has to work to reach to this level before sodium takes over, right? And same is ulta. If the level reaches to this point, if the resting membrane potential is at a higher so immediately he'll reach to sodium, and things will become fast. But there is so far all good. There is a small catch. We'll see that. What the catch is, if the resting membrane potential, say over here, I'm now giving you writing the numbers. So this was, let's say, normal minus 70, or minus 70 is okay, right? And we just need something. This is minus 60, at which the sodium would be triggering. And till this point of time, it was happening like this, and the rest of the journey was continuing. Now this is a new situation. In this new situation, the level is over here. Our current level is over here. So what is happening? It will quickly reach to this sodium, and it is at this point when the sodium is supposed to fire. Right? Sodium would fire. But it would be like this. It won't go all the way up. Reason? This firing is occurring at every cycle. Every time it is happening. So now sodium channels, they are not getting enough time to reset themselves, because this is not happening once. This is happening in every time. So every time, if you tell someone, chalo, let's run, then after a few cycles, right, his speed would decrease because you're not giving enough time. Over here, the sodium channels, when it was going all the way up, then it was going all the way down, and then making and then the next round was up. Now here too, it is coming more rapidly. That's why sodium channels, they are not getting enough time. And that is where you start getting the weak reply. No worries. I'm just telling that these type of things would come. These type of explanations would come, right? Which will be where you have to really visualize, where you have to really think. In the patient, why should there should be decrease in the potassium? क्यों कम हो? Any reason? Simple. खाना ही कम खाता है, right? Less intake of potassium. In our body, sodium is important, but potassium is vital. In our बाहर का खाना, they always use sodium. Hypokalemia, yeah, that's right. This hypokalemia. So they use that sodium chloride. Sodium chloride is tasty. It will trigger the taste buds more effectively, not as compared to the potassium chloride, the Himalayan salt, etc. Those have very sharp taste, right? Sharp effect on the tongue, sodium. So in all those, they'll keep this food. It happens, but there are so many harmful. One is the high blood pressure, simply because of the sodium. So decrease intake of potassium. So if any patient is there, so you tell them to eat pineapple, one slice of pineapple, enough. One nariyal pani or two nariyal pani in entire week, enough, the patient. But we don't take that. We take the Coke, we take the soft drinks, right? They are so harmful, but loaded with sugar. Then if someone has taken laxatives, that is, laxative means which increases the stool, right? So this is given patient of constipation. Kabajia. Banana is good. Definitely banana is good. Right? So constipation. When there is abuse of laxatives, abuse means every day if someone is taking. So in all these laxatives, they open so many channels so that even the nutrients, they are also lost. The third is when someone is having vomiting, right, severe vomiting, you'll find that after vomiting, because vomiting, diarrhea, they lead to loss of large amount of electrolytes. That is the reason that when the person is having severe vomiting or diarrhea, instead of giving plain water, you should give them the oral rehydration solution, ORS. Very cheaply available packets, right? Their cost is almost nothing, 15-20 rupees. If it is not available, so then simple plain water, add some salt, add some sugar, right? Add some lemon available. The best thing, give that. They will be fine. So vomiting. In some of the cases, when the diuretics means if person's blood pressure is high, then doctors will be prescribing the diuretics. Diuretics, these are the medicines which will allow the water to go out of the body. Which will allow the water to go out of the body. When the water is going out, water is getting thrown. So that means this is the capillary, but this is the artery. In artery, there is now less fluid. Less fluid means there will be less pressure generated on the wall and the blood pressure would come down. Blood pressure is nothing but the pressure which is generated by the blood onto the walls. Now, if the blood is less, arteries, so they are same. So if the pressure is less, if the blood is less, because you have say given diuretics, so in patient's blood, the water content has decreased, the overall fluid has decreased. So there will be less pressure and the blood pressure would decrease. But kidneys, they are not understanding. When the diuretics are in action, it can lead to potassium wasting also. that means potassium would be lost. And potassium would be lost. I said it can be. It can be means what? It can be means that there are some medicines, like say for example, spironolactone. Right now, don't even remember this. If you can, it's fine. But spironolactone, this particular group, it is potassium sparing. They are called as the potassium sparing. So just before the potassium is getting lost, they'll say potassium aja, right? You don't have to go, let the water. So the potassium is taken back. So that is how the potassium is regulated. Potassium is big boss, like in our body. Potassium, just to remember this, potassium is big boss. If anything happens to this potassium level, right, body ki halat. That is the reason. And when we say that the potassium level is changing, we are stressing so much because that is what is responsible for our membrane potential. Membrane potential. So these were like normal, laxative, vomiting, diuretics, etc. That is where it is lost. Now, when we say hypokalemia, right? This was hypokalemia, and we have ORS likewise also. You can. There's no harm in taking ORS. One can take. Now we talk about hyperkalemia. For any of the hyper, all we need to understand is that this is the cell which is loaded with potassium. Right? It is loaded with potassium. And when we measure that this is the potassium which is high into our ECF. That means from the inside, from the ICF, this potassium should be put into the serum. So in other words, from that cell, it should come out. The condition, that means these cells should break. These cells should break. If large number of cells break, so then it will come out. Right? One, crush injury. That is called as the crush injury. When there is crush injury, when the tissues are massively broken, so that will lead to hyperkalemia. Second, when there are massive burns, the tissues are burnt, so there will be. When there is severe infection, right, what is called as the septicemia, severe infection. So in severe infection, there will be massive tissue breakage. The tissues are getting destroyed. So when they are getting destroyed, coming out. When there is any of the major surgery, so surgery is not. Surgery is a planned. Crush injury. So this is like an accident. While surgery is a planned, say, cutting of the tissues. But in that case, it will start rising. Then, very common, kidney failure, renal failure. Renal failure. So normally kidneys, can this potassium be removed by concentration? No, that is concentration gradient method. You don't want to remove the calcium. You don't want to remove. Potassium is needed. You need to preserve the potassium. Which second point? Massive burns. Yes, burns. That means tissue destruction. No? Tissues destroyed. When the tissues are destroyed, the potassium would come out. Renal failure. Normally, kidneys. So they are just balancing. These are the reasons for high potassium. Right? I wrote it over here. Hyperkalemia. Increase potassium. Renal failure, kidney failure, whether it is acute or chronic. Acute renal failure or chronic. So in all these cases, the potassium that is increasing. Right? So when it is increasing, yes, we need to say balance it out. There are methods by which we can increase or decrease it.
So,
Huh?
so how come in severe infection the potassium level will be high?
In which one?
Severe infection, 0.3.
Severe infection. Infection is what? The infection is also a sort of tissue destruction. In infection, when we say, okay, there is pus formation. Pus formation is what? Pus formation is nothing, but it is a battleground where our brave WBC count, right? WBC white blood cells, they fought bravely with the bacteria, and the bacteria are dead. Our WBC's white blood cells, they are dead, and their dead bodies are lying, and the pus is nothing but it's combination of all those things, right? So pus means it is the place where so many of our WBC, they sacrifice their life in order to fight with those bacteria. So this is like a playground, and this is like a war ground. So, and when the tissues are broken, right, because they are also cells, WBC, they are also cells. When the cells are broken, so there is what we have. ECF, that is in ECF. Next. Because only that is where you can measure. Very simple. We can't go inside the cell and measure the potassium. We can't measure. So when we say that increase potassium, that means we just take the blood and then we are measuring it into that. So it is the ECF which we are measuring. So normal level is about say 3.5 to 5 in the ECF, right? Milli equivalent. When this thing increases to more than 5.5, so that means we are talking about hyperkalemia. Right? We are talking about hyperkalemia, more of the potassium into the serum. That is ECF, right? Into the ECF. So when there is increased potassium, that is more than 5.5, sometimes it can be asymptomatic. Maybe nothing is happening, or then when it comes to skeletal muscle, it can give rise to muscle weakness in case of skeletal muscle. When it comes to nerves, so we'll see that there can be the paresthesia. The answer of all these things will come when we'll be discussing action potential. Right? So when we'll be discussing, I'm telling you in advance why. Because the importance of potassium is so much important. So when it is more than 5.5 milliequivalent per liter, and these are the things which can occur. Paresthesia means as if heart swim, right? Will feel like as if there are someone is putting those pins. It is called as the pins and needle sensation. So there is numbness, right? You feel jump. So that's what I'm doing. Paresthesia is that. It is TH. I am shooting everyone. Open the bird. So paresthesia, the spelling is THESI. Okay. So here I just write this. This is paresthesia. So I'll write it like pins and needles sensation. That is. Then there would be oliguria. Possible. Yes, that would be when you sit at one position for a long time, right? So actually, what happens when you are sitting in one position for a longer time. So actually, there is decrease in the blood supply, and when there is decrease in the blood supply, so along with decreased oxygen, along with there is change in these potassium levels to the tissues, right? You will feel like as if there is numbness. There is numbness. पाँव है पता ही नहीं चलता. That is a numbness. Yeah, you are right. Then oliguria. Oliguria means less urine. Right? Less urine. Less urine. Now, oligo means. So this is affected to kidneys. And now we will find that palpitations. Palpitations. When person feels that his heart is beating. His heart is beating. Over here, if this is the sign, then it might be the beginning. Might be the beginning, because at a later stage, as the potassium level starts rising, right, it may go into the cardiac arrhythmias. When the heart starts beating irregularly, then there are various complications. Can you figure it out at early stage? Yes, ECG. On ECG, you can really see, and we'll really see those ECGs. Right? But remember, ECG will indicate that there is hyperkalemia, but ECG won't indicate the severity, right? It won't indicate the severity. That means how severe is the hyperkalemia. For that, you need to go for the labs. Right? You need to take the blood. That will tell you about severity. So this is the reason that in our body, things are so important. Tachycardia means increase in heart rate. Right? When the heart rate goes high, it is called the tachycardia. It means every beat that would be coming much faster. That is tachycardia. And when we say bradycardia, that means heart has slowed down. So tachycardia ECG would mean a person might be hyperkalemic, right? No. We can't stamp it like that. Right? I'm just telling right now that this is when he feels that his heart is beating. And regarding the increase or decrease, so when the heart rate it increases, so it is called as the tachycardia. And when the heart rate decreases, so it is called as the bradycardia. There are several things into that, right? In the form of whether this increase in the heart rate it is irregular, right? That if you do exercise, your heart rate would be increased, right? So if it is going like this, so it will be more rapidly. If it is happening like this now, say what you asked, it's a good question. Taking it, right? When you blow a balloon, so that means you are pushing the lung so that air is going into it. Right? This is as good as what is called as the Valsalva maneuver. Right? Very long topic and very, very complicated. But this particular thing is like if someone is getting dizziness on such action. Say for example, if someone feels dizziness when passing the stool, right? When someone feels dizziness when he or she is blowing the air, right? Or just generating the pressure. So that is, or one of the questions which was asked is that my grandpa, right? When he's lying, he's fine, and when he stands up, he feels everything is dizzy. Right? That is what is called as the postural hypotension. That means when the posture is changing, there is drop in the blood pressure. As such, it would not happen. Our body is having such wonderful mechanisms that immediately it compensates. But when it is not happening, that means there is something which is going on, which is to be investigated. हाँ, say systole, diastole, कोई confusion मत रखो हर्ष. We'll be discussing this in superb detail when we'll be talking about the cardiac cycle. Right? We'll be discussing extensive detail. And if you are, I just got your message. I feel it sometimes. If you are feeling it sometimes in this young age, those things will not occur. The chances are very high that if you are trying to eat less, if you are trying to do dieting, not pointing at anyone, right? Not pointing at anyone, but sometimes it happens like in order to look slim, we feel like nahi zyada nahi khana. We try to avoid the food. Mat karo, right? Nutritious food that is needed. It happens. Achha. One very amazing concept before we end our today's session. This concept is about what is the importance that when we eat something, say this one is our GIT, gastrointestinal tract, intestines. High. That is the glucose. Right? The glucose has come into our stream. When the glucose comes, it leads to release of insulin. It releases insulin. Right? That insulin is there. From where is it coming? From those pancreas, right? From those pancreas. In pancreas, there are GLUT receptors. They will say, "Kare, glucose bada," right? That glucose from GIT when it comes to bloodstream, right? When it comes to bloodstream, from that blood, it reaches to pancreas. In pancreas, there are GLUT receptors, glucose transporters. They detect and they say, "Okay, insulin, go," right? And that insulin is fired, and as such, that insulin will be picking this glucose and will put it back into the liver. The story doesn't end. This is to sabko pata hai this is what happening. Insulin when it is given. That's why if the insulin is not getting produced in the body, the person has to take that insulin from outside. Right? Especially there are two types of diabetes: type 1 and type 2. Type 1, which is congenital, right from the birth. The babies, they are unable to produce any insulin. So they have to take those insulin shots, right, in an abdomen for whole life before every meal, regularly. That is what is called as the type 1 diabetes. It is not only that the insulin is needed so that glucose is put back into the liver, but it is for some other reason also. The other reason is, think it that way, that person, even if he has consumed anything, right, still they are feeling weak. The insulin is not given. They might faint if insulin is not given. Reason? The glucose which has been absorbed into the bloodstream, and when it reaches, right, when it reaches to the cell, right, this is our cell, and when it reaches to the gate of the cell, and telling the cell, okay, absorb me, right, let me come in so that I give you the nutrition. This thing is controlled by insulin, one. And second, very vital thing, the sodium potassium pump, which is the vital pump, the ubiquitous pump, the pump which is present everywhere, this is also controlled by insulin. So when this pump starts getting affected, it affects the entire system of the body. This is the importance of insulin. Right? This is the importance of insulin. And when we say that when we exercise properly, the insulin resistance, it decreases. Right? The insulin, even small amount of insulin can play the entire game. In the same way, just consider that this is a kid, and we tell this kid, "Chal beta, khana kha le." खाएगा नहीं. We tell it once, we tell it twice, we tell it 3 बार बोला खा ले, अच्छा खा ले. It means what? This is resistance. Right? It is resistance. Time to time, I'm insisting that those बाहर का खाना मत खा. Right? I received many of your emails. You said कि बाहर का खाना मत किया. You are happy. कोई तो बात, right? Because all those things, they don't really care. They are interested in making money. They'll put all sorts of bakwas kachra so that you spend money. Right? Do hell with your health. No one cares. So what happens is the bicarbonate, it leads to insulin resistance. That means when the large amount of insulin is there, then the whole process starts. Right? Till that point, the glucose level, it keeps on rising because insulin hai aur sunta kaun hai uski. Right? So that is what is called as the insulin resistance. This is such a topic, insulin resistance. Right? In detail, will definitely be. This topic will last for 1 month. The entire glucose mechanism. It is so amazing that you'll be knowing ins and outs of everything, so much so that you'll be able to design the drugs. For this diabetic patient, which medicine should I give? If you understand that entire process. Right? Any of the stress, Tanvi, any of the stress can lead to insulin resistance. Right? It can lead to insulin resistance, and pregnancy is one of the very big stress. Right? So this is just to show that why these things are so important. All these electrolytes, they make a very important role. When the sodium is high, so that is called as the hypernatremia. Right? It is called as hypernatremia. Or same way when it is low, it is hyponatremia or hypernatremia. So in the ECF, that is into the serum, right? When you have taken the blood of a patient and then you tested it, so the 135 to 145, that is the normal level. And these levels, they are very strictly controlled into this particular range, very strictly controlled. So anything more, it is hyper, anything less, it is hypo. So for resting membrane potential, what would be, who will make the difference? Increase in the sodium level will make the difference, or decrease in the sodium level will make the difference? Resting membrane potential will be affected by hypernatremia or hyponatremia. Hyponatremia or hypernatremia. Okay. We have got one for hyper. 3. Four, 5, 6. Question is that resting membrane potential is affected by increase in sodium or decrease in sodium. Almost 8, 9, 10. All right. Answer is nothing proud of. None. Those none. Neither hyper nor hypo. Resting membrane potential is affected by potassium. अभी भी क्यों increase लिख रही हो? The thing is, resting membrane potential तो potassium पे dependent. Sodium will not be coming into the picture. So if there is more sodium, there would be more opening of the channels. So जो भी action होगी वो यहाँ से, it would be in the phase of depolarization. Remember this. That's when the sodium is high or the sodium is low. Which phase is affected? Depolarization. depolarization. Got it? Right? And when the potassium is high or low, it is the resting membrane potential which will be affected, because that level will become up or down. Right? Drawing it again. So जो आपने draw कर रहे थे. So this is the resting membrane, right? Resting membrane potential, and this is the level when the sodium would be fired. Right? Sodium will be firing, and then sodium will start making the changes. So this much journey, that is by potassium, and then from here, it journey is by sodium. Right? ठीक है ना? Right? So resting membrane तो यहाँ पे है. At this point, the sodium has got no role. कुछ नहीं करता. Sodium starts working from this point onwards, because these are voltage gated sodium channels. So this is the concept. I think now you guys are pretty ready, right? Pretty ready. And from next time onwards, we'll be starting with the action potential. Now keep this base very clear. If this is good, now every day we'll be, every session we'll be learning much more. Right? Now the volume would increase from the next. Volume would increase means in every lecture there would be multiple points covered, much more. So as far as possible, we won't be able to repeat, right? We won't be able to repeat anything. So that's the reason that from next point onwards, till this point everything was fine, but from next time onwards, won't miss any session. These lectures are going on, I think, 1 month. We are since 1 month. 1 month. All right. So I saved this file and I put it into our folder. Thanks a lot. Thank you so much. Wish you all a happy weekend and take care. See you next time. Thank you. Yes, send a mail, send a mail. Yes, you can always send a mail. All right. Thanks. See you.